There we go.
Which one is naked?
You okay?
Yep.
Yeah. Let's get ready to rumble. Huh?
Keine Ahnung.
Yeah, wow.
You see? Kartoffel. Apfelsaft? Jaft? Can't think.
You're good. And even before I started the food lecture.
I know.
Oh.
Yeah.
I'm going to watch you on this.
Okay.
Is it live now?
Yeah, you should be able to, because I'm mic'd. So, yeah,
There we go.
there you go.
All right. Here's Ross.
She's go. She's running away now.
Good morning, everyone. Thank you for coming in again, and that after the big party yesterday. So we do have a 5 minutes delay due to the lack of sleep of the speakers. We'll start right on with someone I really appreciate, and I'm really glad to have him here and call him a friend. And he is the expert when it comes to the treatment of PCO syndrome, which is a great problem in our Western world. Many women suffer from it, and we're good to get an idea how we can treat them and help them with our skills out of the TCM toolbox. So let me introduce you Sandro Grassa to me. Originally he's from Portugal, but now he's living in Dublin, Ireland since many years. Still he wants him to be called some kind of Portuguese. And he is a board member of the EBA, the Evidence-Based Acupuncture Association. He is a teacher at the Northern College of Acupuncture in York. He runs a clinic and he works for an online platform, Healthy Seminars. So he is multitasking, always working. Thank you, you had the time to come here.
Thank you, Olivia. Well, no pressure after that. Thank you. Now, can you guys hear me okay there as well? Thank you so much, Olivia. It's a pleasure to be back here. I was here last year to replace the keynote speech by Professor Hugh McPherson, and I really fell in love with the place. Beautiful scenery, the food's great, the friends are amazing, so thank you so much for having me back, and congratulations and well done to you, Peter, Renata, the whole team, everyone helping in the rooms. They've done a great work, the party last night. Thank you so much for having us here. Just giving you a little bit of a background of what I want to do, and by the way, just a warning up front, there are slides there that will break the rule of too much information for the slides. Just to let you know, I did it on purpose, and the reason being that I want you to have that information. So for those who've downloaded the handouts already, they've actually been updated in the sense that I've just added a few more things to them, and you can then just scan the code that we have, and I'll give you the new updated handouts. The reason why I put all that information there, and as Olivia said about the being a problem for the Western world, I wanted everyone in the room to have the two sides of the story. So on one side, you're going to get this information from the slides, and you can use it for yourself, for your website, for your information when you're talking to colleagues. I know here in Austria, you're in this great position where you are physicians, you are medical doctors, and also practice acupuncture and Chinese medicine. So when you're talking to other medical colleagues, when you're talking to acupuncturists, and also when you're talking to the public. So you can take that information that comes from my background, as Olivia said, working on the board of evidence-based acupuncture. All the other stuff in terms of the nitty-gritty of treating PCOS, obviously you're in this room, you are qualified, you know your gynecology and your endocrinology, you know how to treat PCOS. I'm not going to teach you that. I'm going to give you some guidelines and some guidance on how to put across what you do and how we can place ourselves in treating this condition in the future. So that information and that treatment and all that, like Olivia, I'm also a fellow of the American Board of Oriental Reproductive Medicine, and it is one of the things that it's been ongoing now and trying to bring that to other parts of the world and not just in North America. So the reason why I changed the title a little bit and I put it as that research-informed practice, it's almost like a play with words with what we do with evidence-based acupuncture. I'm sure that a lot of you here know that just because you read something in a study, a lot of the times it doesn't actually translate into clinical practice. So what I wanted to give you is the opportunity of talking about insulin resistance, which is a big player when it comes to PCOS, but giving you the insights from my holistic approach, and this is me, so it's not gospel, so it's my ideas. You may agree or disagree, and that's fine, and let's talk about it and develop. So what I wanted to do, where is the pointer? Is it this one? Yeah. So what I wanted to do was to give you the part of the TCM where I have the, like yourselves, where we studied and we have that TCM background, the research, which I've started in the last few years and getting more involved, and the biomedicine part of it, which is way less than a lot of you in this room, but it's a little bit, and I love learning, so I'm doing more and more of that. But always, always, always with the PCOS patient in mind. So use those three to combine and give the PCOS patient the best treatment possible. So just, quickly, I said this before, just about me. I'm on the board of directors of evidence-based acupuncture. It's been great. And the best thing about it has been the welcoming that we got from everyone. So it's been really, really good. I know the OGK has been really, really supportive as well, so really appreciate that. I'm a fellow of the American Board of Oriental Reproductive Medicine, and I'm also director of international membership for the Obstetrical Acupuncture Association. I work with Health Seminars, which is an online platform, learning platform. I'm also on the planning committee for the Integrative Fertility Symposium. Olivia's been there. Some in the room might have been there as well in Vancouver. It's a great place to exchange ideas and learn more about fertility. And I'm also a lecturer in the Northern College, and I'm also doing my master's degree. So this is not for boasting. This is actually just for you to know, and when you're talking to someone, just explain and give the background and place yourself. So I said I was going to place the PCOS and the insulin resistance in the context of how to treat the patient. This is me placing myself to you and say, like, this is the way that I see and the way that I put things across. I see it through what I do. Last year, for those who were at my talk yesterday, I mentioned this, that last year Lauren and I were at fertility conference in Melbourne, and Jane Littleton said something that really, really stayed in my mind, which was, it works in practice, but does it work in theory? And we see a lot of that in our clinics, right? A lot of the times we see it in the clinics, that it works there in front of us, but then when we go and look for how does this work, we can't find, and it's almost like unexplainable. It's a bit like the patients, right? They get better. How did it work for you? How did you get better? I don't know. They put needles in me and I'm better. So it works in practice, but does it work in theory? Is it super important? Not really, but it would be handy to be able to explain to the patients, to explain to the public how and what is happening to them. So for those who were here last year, I presented the one up to 2018. John McDonald keeps updating this amazing chart every year. And you can see the amount of information that is there. So that is the number, that's just for the Cochrane Central Register for controlled trials. And I was always very surprised to see this number going higher and higher and higher. And a lot of the times we don't realize like the amount of information that is out there, the amount of research that is out there. And it's, last year, just quickly, last year at the EBA symposium, we had John Weeks, which is the editor-in-chief of the Journal of Acupuncture and Complementary Medicine. And he said that, you know, the research is out there, the evidence is out there, but who's reading it? Who knows that there's that much information out there, even compared to other practices? Who's reading that? Are we reading all that? Do we know? That everyone here in the room, did you know that the number was that high? Because I'm always surprised with how high the number is. So basically what I've been doing, and it's part of the work, not just for me, because I love it, but also with the EBA, is just really trying to get this information across and get it that other healthcare practitioners know about this, the public and the patients know about it and they understand what it is. And mainly one thing that we shifted over the last while is actually healthcare policymakers, the people who decide what type of medicine is provided in healthcare centers, in hospitals, in private clinics. Those people, a lot of the times, they don't have any medical training, let alone TCM training. So if you start talking to them about points and acupuncture and channels, they have no idea. A lot of the times, they're not even medical trained. So how do you then explain to them what you do and why they should have your service in their clinic? So the talk, and again, for those that were there yesterday, we went into very, very much detail into this. I changed things a little bit since the new recommendations came out for the treatment of PCOS. And the first thing, and me being, you know, half Portuguese, and that the first thing that I searched for was, is there acupuncture mentioned in the guidelines at all? And you'll see at the end that is mentioned once, and that really, really pissed me off. And so I was like, okay, so can I still get anything good out of this? So I looked at the main 4 points that they had from the recommendations, from the guidelines, and what they want to do is they want to focus on improving accuracy of diagnosis. Okay, maybe we can help with that. Reducing unnecessary testing. Okay, combined therapies, maybe they don't need, you know, our diagnosis, maybe we can help a little bit there. And then things started to get really, really interesting, because then they started talking about increasing the focus on education. I'm like, oh yeah, I love doing that. Lifestyle modification, we do a lot of that in our clinics. Emotional well-being, yeah, we do that. That's the theme for next year, right? And quality of life. And I was like, oh yeah, so yeah, ask us, you know. Again, pick me, you know, I can do this, but who's listening? And the last one, emphasizing evidence-based medical therapy and cheaper and safer fertility management. So I looked at those 4 and I thought, okay, maybe we can actually play with this. Maybe we can work around this and place ourselves there. But again, they need to know what we do and how we can affect these particular areas that they want things to change in the assessment and management of polycystic ovary syndrome. So for those that keep up to date with the Cochrane reviews and, you know, with research out there, again, remember, I'll just note here that on the slides, and you'll have these when you scan the QR code, I put the references for it all, and again, for you, for the website, for your own leaflets, just for information. The Cochrane review was updated last year, and this nice sentence that I picked out of there, PCOS has become a major healthcare issue that deserves an increase in focus both from clinical and public health perspectives. So you see where I'm coming from with not just telling the other practitioners, our colleagues, but also informing the public and trying to get the people who run the clinics, who run the private, you know, being hospitals, being private clinics, healthcare places, that they know about this and that we can actually help as well. I really, really love this picture, and not only the picture, but also that's modified color, but that particular sentence, the constellation of clinically recognizable features, signs and symptoms, is, and no disrespect to everyone here who is a medical practitioner, but it's a really lovely way of saying we can't really define it because it's so different for everyone. But I like the way that it was that was put there. So PCOS, it's one of the most common disorders in humans. It affects more than 1 in 10 women. It's the most common endocrine disorder in women of reproductive age. The worldwide prevalence of PCOS ranges from 4 to 21%, and that depends on the diagnostic criteria used. You know, we know that there's 3 different ways of diagnosing it. And it has a very, very high percentage indeed of women that actually remain undiagnosed. And I mentioned this to the people that were in the room yesterday, that I'm sure that we all had this. We're in clinic and, you know, woman comes in and says, well, I'm a bit confused because my gynecologist said I have PCOS, but then I went to an endocrinologist and he said that, no, you don't have PCOS. So do I, don't I, you know, where am I? Now, why is it important? You know, why should we care about treating PCOS? Well, infertility is probably the main reason why we're going to see those women in the clinic in the first place. They're trying to conceive and they just can't. It's not happening for them, most of the times due to no ovulation. The pregnancy-related risks. Remember, PCOS doesn't just end when you're pregnant. There's all the issues, not just for the mom-to-be, but also for the baby. The metabolic issues, again, even for those that do not wish to get pregnant, there's still issues that they need to consider. And a lot of these are really, really important for the healthcare system, and they are really, really resource consuming for any healthcare in any part of the world. And something that has been coming up more and more in all the papers is the psychological side of things and how they really are looking at that anxiety, that depression, the impaired quality of life. You can really imagine this, like to put a picture there. Think about your like late teens PCOS, or even early teens, it doesn't matter, but like the body hair, the obesity, that's going to make that girl feel really, really self-aware of what's happening to her. Yesterday I went into detail explaining this. This was something that came up at the infertility symposium this last year. You were there, you might have been in the room. Dr. Jacqueline Schaas mentioned this and it really made sense in my head, and it was for immune conditions, but it really applies to to most patients anyway. But when we see the patient in the clinic, we don't see them just after something happens. We see them after a lot has happened. A lot of the times, this is my last resort, I'm here to try and fix this. No one else could fix this, right? And Dr. Jacqueline Schaas gave this example of, it's like having a football field full of ping pong balls. And the cause, like for us, we know that there's a root and the branch, right? The cause of it is the first ping pong ball that it's thrown in there. But when we see the patient, we don't just see it when it's happening. We see it at a time where the whole thing is just going all over the place. And this, if you remember from one of the slides before, like the unnecessary diagnosis, I can really relate to this. Like if I was in my clinic as a reproductive endocrinologist and someone is coming in like this, like where do you start? Like the whole thing is just going mental. And even if you were to find the one cause, that ping pong ball, if you were to take that one now, it doesn't make any difference anymore because the other ones are triggering all that cascade of events all over the place. And that really made sense to me when it comes to the PCOS and how things then go and develop and at what time do they come up to the clinic. So I'm just looking at, again, to have for your website, for your information when you're talking to someone and just saying to them, look, hospital admissions for women with PCOS are twice as high. I was actually surprised seeing that and thinking, wow, that is a lot. 43% of women saying that they're not happy with their sexuality and feel less attractive to their partners. Again, easy to recognize, right? Obesity, the hirsutism, they're not, ovulation, all that hormone issue that is going on there. They just don't feel well with themselves. And then the realization that there is a need for women with PCOS that is not being adequately met, and evidence practice gaps still persist. So can we help? I would like to, if there's a goal from this presentation and from the one yesterday, I mentioned this before, is that I plant a seed. And you go like, oh yeah, that guy, yeah, let's go and take more from that and build on that and let's do more and let's just bridge that gap. Many women with PCOS report to be disappointed with the information provided to them. Again, about lifestyle management. We do that really well, don't we? Like we do that in the clinic all the time. So maybe once you start looking at this, maybe we can actually put ourselves in a place that we can help. And again, for those that want to read the full guidelines, I took that particular sentence almost on purpose because I really like that thing that when I was reading and I came across the importance of looking at the patient as a whole, I thought, am I reading one of my TCM books from college? Because you hear this a lot when you're learning Chinese medicine. But this is the international evidence-based guidelines. Like, again, we do that all the time. Now, word of caution, I do understand and I get it. A lot of the times, most of the times indeed, the patients are coming to our clinics because they want to get pregnant. So you have to respect that. And they are there because they are starting or they're on that journey to try and have a baby. So that's fine. You can work with that. But bear in mind that it's also our duty. And again, most of you, like everyone here in Austria, but most of you in this room as well, have some sort of other medical training. Our duty is to help them and educate them and decrease that risk of long-term risk factors that they are more prone to because of having PCOS. And again, just for you to have as a reference, a 4-fold increased risk of diabetes for women with PCOS. And that doesn't matter their BMI, doesn't matter what age they were diagnosed, that's a 4-fold, that's a lot. But you can also focus on health. So they're there to try and get pregnant. Your duty is to help them and, try and talk to them and say to them, look, this happens. And, there is a link between the PCOS and other conditions like metabolic issues, diabetes. Talk to them, talk to the other clinicians that are in your practice. And I just thought it was funny because for those that follow the whole research with PCOS, every once in a while we hear this. But again, on this particular paper, they were talking about changing the name of PCOS because is it really polycystic, ovaries, multifollicular? You hear about this with PCOS all the time. So again, this is from 2019, and they're still talking about maybe we should change the name. And that's because of the metabolic issues. So this is one of the few slides that I added really recently because I really like the graphics on that, and they're really helpful for us to know. Remember the ping pong balls and where everything is going all over the place? You look at that and you would imagine that a graphic would make it easier, but you just look at that and go, okay, so where do I even start? Which one influences the other one? And where do you start the treatment? So this is actually from 2019. It's from a group of researchers from Brazil. And I put that out there because I know they're talking about the insulin resistance and the hyperinsulinemia being the central mechanisms, but I also understand that the androgens do play a big part. So this is like my disclosure. I'm on the Androgen Excess Society, sorry. And I'm also a member of the ASRM and the ESHRE. So I don't be team androgens or team insulin resistance. I like to address the two of them. I just think that for us in terms of public health, I think we can get there faster and from what we do if we look at the insulin resistance and the metabolism side of things. So what they said in this new study, they had this better care and clinical management was the main thing that they wanted to achieve. And as I was reading through the paper, there was this graphic there. Remember, this is not a Chinese medicine paper at all. And I was like, went past it and I was like, hang on a minute, I've seen something like this in my TCM books before, haven't we? Doesn't that look like something that we have as well for ourselves? So again, remember, this is not a Chinese medicine or acupuncture paper. And I was like, yeah, can we now just go and add a little bit to that with our acupuncture and our Chinese medicine, go, hey, you've seen this paper that came out in 2019 and they were looking for all this better care and clinical management. Hey, we can do something with that too. Again, full disclosure, don't take it from me. Jane Littleton, direct quote from her, TCM is quite well placed to address PCOS, and the reason is that we don't look for a particular cause. We don't look for a standard treatment. We look for patterns in individuals. So mind the patient, and what that means to me is that do not treat the piece of paper in front of you. A good friend of ours from the US, Chris Axelrod, was the first one, and the quote is his, so I'm not using it. It was his quote that say, do not treat the piece of paper in front of you. Just because it says that, oh, your bloods are this, talk to the patient, look at the patient as a whole. And then here in Austria, you have something amazing, which is you can combine your biomedical diagnostic tools with your TCM diagnosis and make the most out of it. Don't just choose one, use both. This is the part where I put these slides there just for your information. Again, you can have them all, but this is from 2013, Elizabeth Sterner Victorian and Johansson, I think Helen is her name. Both androgens and insulin are considered to be key players in PCOS. I mentioned that before. I don't go with just one or just the other. I understand both. As I said, I just think that with the insulin resistance and the metabolism, we have a bigger part to play. And again, I just put that on your slides. That's from the study itself, so it just makes it easier for you to follow. Insulin resistance present in 95% of overweight women with PCOS. And I was really surprised with this one, 75% in lean PCOS. So just because they look fit and they look well, it doesn't mean that, you know, either the PCOS is more or less. The insulin resistance is still there. And then the insulin resistance, yes, in that adipose tissue will lead to inflammation. And we all know inflammation is like that ping pong ball, like the field full of mousetraps with ping pong balls. Prevention and treatment of obesity is important in the management of PCOS. Can we do that as acupuncturists and TCM practitioners? Yes, we can. So maybe we should place ourselves in, okay, I can help the clinic with treating the PCOS. Why is it so prevalent these days? Well, lifestyle, really. We do way less physical movement. Doesn't matter how many times it tells me to move. We still don't do as much as we should, except at the party. We did a lot of that at the party, so I hope you were wearing your Fitbits during the dancing. Genetics, again, yeah, our ancestors had a nutrient-rich diet, lower in carbohydrates. We don't really. Environment, again, inflammation is everywhere. We know it from the water that we're eating and from the food that is out there. And high stress. You know, it's a big, big deal. Like, we all know about the stressed out patients that come to our clinics. And just a quick note, probably those lean PCOS ones are in that liver qi stagnation side of things, and it's that high stress that they're under, either because of trying to get pregnant or because of just life in general. Oh God, Olivia, you're going to have to help me with that one again. I think you're one of the green ones, right? My geography, I'm sorry. So this is 2014, the prevalence of female overweight. And I added this one just to put into contrast with the new, they're not really guidelines, but they're the trends that they're seeing, that by 2025 it will be 1 in 5 women. And even for men, it will be up in the 18%. But yeah, that's 1 in 5 being obese. Maternal obesity, again, remember that the PCOS doesn't just go away with pregnancy, and we now know from the latest update on the meat tofu that those children from the mums that were taking metformin throughout the whole pregnancy, those children are bigger. So the new guidelines are to stop the metformin at 12 weeks. For overweight women with PCOS, lowering the body mass by 5% can reduce the serum insulin, so a small change matters. Again, place ourselves, we can do this, we can help with our acupuncture, with our herbs, with our lifestyle advice, and every little helps. It's only a little bit, but it will help. And it doesn't have to be just acupuncture and herbs. Moxibustion, you know, there was, yesterday I kind of went into more detail with this one, but the study is there so you can check it out. They were using moxibustion to reduce the waist to hip ratio. Again, this is just for your reference, you know, acupuncture and what are the proposed mechanisms for acupuncture and insulin resistance. We know that it helps with the metabolic disturbances in obesity, diabetes, hypertension, and then obviously in PCOS as well. I just put this here because I love these, and I love kind of like both sides of it, which is on one hand it's really useful, but on the other hand it's one of those things that you can have in your clinic and you go, so what? These are the top 10 points used for research when it comes to acupuncture for PCOS. And then you go, would you use them all at the same time? Would you use them all of the times? Not really, but to me, I always like to look at it and go, oh yeah, I use those points. It's almost like validation of what you're doing, and you feel better that those points are there. And full credit to whoever put that page together. There's a page actually on the OGK website. Was it you? Well done, Olivia. that actually does have a few of the studies and has a little bit more than just the abstract. I mentioned yesterday, do not go down the abstractitis route. Don't just read the abstract. And it actually has the points from the studies as well. So 1 or 2 key sentences from the study and the points from it. So that page is a really, really good resource for everyone in practice. Again, I put the link there so you can have it from our notes. There's a big study going on, and they are anticipating that the electric acupuncture and the metformin, both with lifestyle management, will be effective. So that study is ongoing, so I'm looking forward to seeing the results from that. And there's other forms of treatment as well, and we had here laser acupuncture being mentioned during the photobiomodulation. There's that stuff going on with research for PCOS as well. So it's out there, and it's not just the acupuncture and the herbs. So how do you put all this into practice? There's one study that, again, small enough study, but just trying to take all that information, putting it into context, and seeing, can it be used in the clinic, can it be used in the hospital, and is it making a difference? And I know it's a small study, but it's handy for us to know. And this is what I see as the importance of knowing how to search, find, and break down these studies to have on your website or have when you're talking to other healthcare practitioners. Again, thinking outside the box, vitamin D, again, something that surprised me, 67 to 85% of women with PCOS being vitamin D deficient. Vitamin D and calcium supplementation actually making a difference for insulin resistance. And again, the resource is there, so you can go and check it out. I'm Portuguese, I'm living in Dublin. I get my sunshine from a little bottle now these days because, you know. And herbal medicine combined with moxibustion as well. Again, I couldn't find the top 10, but I did find the top 3, which is actually 4, of the herbs that are used for the studies when they're doing herbal medicine for PCOS. Again, it might be handy and useful to know those. We all use those herbs anyway. So what's there for the future? What can we do? What can we expect? What's in it? What's going to happen next? So this is what I was saying to you at the start. I searched for the word acupuncture. It comes up once on that on the guidelines, and it's towards the very end, and it's on the question mark scenario, and it's for future research, and it's asking that there should be, or to encourage future research into finding out if acupuncture is effective for depression. Do we know this? Anxiety, disordered eating, body image. And I was just reading through that, and I was like, yes, we can, yes. So this is the question that is there. So this is the purpose of this talk, is to say, yeah, okay, you want more research on that? We can learn a little bit more. We can help with the research, and let's get ourselves on the guidelines the next time that the guidelines are out. And again, remember, place that within the 4 points that they want the most. If that's what they want, and they want to know more about acupuncture and anxiety and well-being, let's give them that, let's help with that, and let's all work together to make it better. Obrigado, as they say in Portugal, or Dankeschön, as they say here. And as I said, the QR code is there. You can scan it to get the notes as well, and all the references, just show you quickly, the references are there as well. So you can have all this information for yourself, and let's change the world. Thank you. And thank you for having me here.
So thank you for the interesting talk. Our next speaker is coming to us from Hungary. I am very, very happy to introduce Professor Dr. Gabriela Hadji. I hope I pronounced
Yes,
it right.
it is correct.
Wow.
Where can I?
You put it on the desk.
It is better. No? Do you mean? It is better. How? It is okay? It is open? It is open. Okay, no, I have it.
This lady is responsible that we got included.
Dear colleagues, ladies and gentlemen, first of all, I would like to many thanks to tell to Olivia and the staff of the Olivia and everybody who was organized this excellent conference. and many thanks for my invitation. Basically, I am the professor of the Complementary Medicine Department and TCM Confucius Institute in Hungary, which is the one in Europe. And it was a long work for me, 15 years, to make it and to organize it and to establish it in Hungary. Now, my basic topic is the Yamamoto's acupuncture, because I established the Yamamoto Institute in Hungary 35 years ago. And I deal with the handicapped children and the stroke patients after stroke. But this topic is a little bit interesting. No, I have this one. Does not? For the Okay. No, it means that recently we established in Hungary the Hungarian Integrative Medicine Alliance with 45 different associations and foundations, and we are very proud to make the next conference for this. I hope that we make a bridge, and we will bring a bridge between the Eastern and Western medicine scientifically, and to be more accepted all over the world. Today the topic is the NADA and the battlefield acupuncture, the new methods for the pain killing. To turn back to their history, the Paul Nogier and his son Raphael Nogier, they established the ear acupuncture. And Paul Nogier had a hypothesis, the point cauterized on the antihelix relieves the sciatica. Maybe this point corresponds to the lumbar area. And the second was the possibility that the ear is the set of the larger reflex therapy. And the working methods of Nogier was the pain on periphery provokes a representative pain on the ear. This is a small history. And later they found the other localization for the neurohumoral system and the skeletal system, the neurological system, and so on. About a few words about the auricular-therapy. The first publication was in 1956. And later, the Chinese government announced that they have the ear acupuncture table as well, but it was top secret till now. It means that from the Western countries was proved the Eastern ear acupuncture. And later, it was the first book published, and the WHO in Seoul and Geneva and the Lyon organized and made an acceptation of the ear acupuncture. In 1994 was the first international symposium for auricular therapy. This is a very excellent event was in the Lyon, and Paul Nogier and was accepted well all over the world. What about auricular therapy today? In France, of course, there is nourishing, and in Europe, Switzerland, Hungary, Italy, Austria, Slovakia, Romania, and so, and all over the world, mainly in the Latin countries, is accepted, but Israel has the Auricular Therapy Association. This is a very nice picture of Hieronymus Bosch, and he had to know something, because this is the point of the shaman and sensorial master points. And he was living only for 60 years, and we don't know what time he born. But this is a very important, this is between the two hemispheres, and this is the corpus callosum, could be. There are two different types of points. This is the painful and the electrical detectable points. They are not the same one. And in physiological situation, we cannot detect the point in healthy persons. We can detect the points only if there is an organic disorder or a functional disorder. Two types are the points, the reflex points. We can look after that in the ear. And the neurohumoral type points, they are linked to the neurohumoral systems. The reflex points are used for the pain treatment. This is the copyright from Raphael Nogier. We worked together in the NATO project. And the neurohumoral points, like this, they could be detectable by the electrical. The neurohumoral points has a lower cutaneous electrical resistance and a higher impedance, and could be linked to the thermoregulation system in the organ. What are the difference between the reflex points and the neurohumoral points to the detection? If we detect the point that this is the reflex points could be detectable, but the points of neurohumoral system belongs to the electricity measurements. The treatment, we use the needle and ASP needle, cauterization and massage, and the points on neurohumoral points, we can set the laser therapy, color light, and the needles as well. What are the indications? The indication is in the reflex point, any type of the pain, and the points of neurohumoral points, the functional disorders. We can achieve an immediate action for the reflex point treatment, but the points of neurohumoral points has a later response, they are delayed. Later, it was by Joseph Helms from USA, contracted the auricular trauma protocol with the Shannon, the point zero, hypothalamus, hippocampus, amygdala, and master cerebral. And after that, it was used in the trauma treatment of the fear of aggression. The sound line is there, but the anti-aggressive points is anywhere here. Later, by Frank Bryan from USA, he was a worker for the battlefield acupuncture, found it the different phase of the auricular therapy. This is the normal, and this is the behind the ear, and this is the degenerative phase, this is the second, and this is the transitional phase to go to the chronic situation of the disease. It means that the phase 1 can change to phase 3, this is the intermediate, and to go to the chronic phase. It means that the topography of the fetus can be changed all the time. It means that this is not automatically to choose the points for the treatment. We like the vectors in the ear. It means that this vector, the omega and zero and the ACTH points, we like against the allergy. We like the 0 point and corpus callosum, this line for the moving disorders and so. This is the symmetry of the cortex. And this symmetry could be seen in the Hieronymus Bosch as well. And this is the corpus callosum connecting the two hemispheres. Maybe the corpus callosum is the connection and to coordinate to the two parts of the hemisphere. They are main points, you know this one, because we use it very frequently, the cortisol and the articular points, allergy points, and the others. You have learned about this. Several master points are existing. And there are some new points and new presentation for the cortical representation of the trigeminal-vascular area and the ophthalmic branch and the innervation of the stria vascularis of cochlear and the antalgic points as well. They are the new find points for the auriculotherapy. Later, it was developed a different frequency for the different part of the body by Nogier as well. And the latest improvement of the battlefield acupuncture. And we were working together with the NATO RTO project between 2011 and 2014. And this is the international group. That time I was involved in the Cambrella Pan-European project for 17 universities researcher. And one time I was called by Washington, the NATO, and somebody asked me, would you like to work on the side of Eastern European countries in this project? Of course. Why? Because it was a lot of work, but it was some information for me. And that was the reason I participated. And this is Raphaël Nogier, and this is Richard Nimzo, the Samueli Institute, and me. I'm from Germany, from Italy, from French. And after that, we turned to in the Medical Acupuncture Journal. Richard Nimzo is the additional board member for that. And it was in 2007, the acupuncture on the front line in military medical cares. It was collecting some points for the year. They were working for the military people in Afghanistan, and the survey was going on the survival time for the military. Because in a case of explosion or bomb or something, they received a shock. And the shock can diminish the lifetime. And for application of the battlefield acupuncture, they were able to survive more time without any shock situation. And this is the reason they received a lot of money from the government of USA. And now the battlefield acupuncture should be known, or the medical doctor in the NATO as well. They are the people, some people you know very well, Beate Schrittmatter and Raphael Soliman, Frank Bryans, Joseph Helms, and others as well. What was the theoretical background and the proof background about the battlefield acupuncture? The functional MRI research on acupuncture, and Margaret Cho was the professor who proved the limbic system associated with the mood and emotions, and it was involvement the thalamus and the phasic pain processing in the humans. You can see the pain stimulation in the cortex, and after the pain stimulation to apply the acupuncture, and the activity could be seen that less activity in the cortex. No, this is the reason it was applied for the military circumstances, and of course we don't like the too much needle. As in the Yamamoto system, only 4, 5 needle, maximum 6, not more. And we would like to apply less needle, because maybe in this case some needle could be helped, but, but not the all. This is the reason it was the feasibility study for that. And we made a publication, the overview of the integrative medicine practice and policies in NATO participant countries as well. It was published a few years ago. What does it look like? This is the ASP needle, and we apply for that. This is a permanent type of acupuncture for a few days. And the insertion is very easy to learn. And the cue of the application is very important. The first is the cingulate gyrus, the thalamus, omega-2, Shannon, and the point 0. They are in the map as well. And how can we do it? The gyrus cingulate in the apex of the notch. And the next one is the thalamus. The thalamus, to find it is very difficult, because each ear anatomically different from the other. We have to be very careful for that. This is the gold needle for the patients. And the next one is the omega-2. And the next one is the Shannon. Next one, point 0. But if we look at the ear, we can see the other signals of the ear. For example, the patient is suffering from lower back pain. It was originated from the uterus. We have to see some patches, some different colors of the ear. And we have to think about what is the origin, what is the root of the complaints. The lumbar pain, and it was origin from the urinary attack. Lower back pain from the chronic gastritis, because there is a different color for this. It means that we have to think about what is the other symptoms, what is the other signal of the ear could be caused the recent complaints. There is the sham acupuncture and the real acupuncture. in the complementary and alternative medicine. The randomized clinical trials were the acupressure for the lower back pain, and it was proved that the real points to use for the lower back pain could be more effective at the same acupuncture. In the Yamamoto Institute and the University of Pécs, between the period, we treated a lot of patients with heavy pain syndrome due to any reason, and it was additionally a routine treatment for that. And we investigated the visual analog scale, and the needle insertion was a longer period, not only 4 days. And we investigated the quality of life with the questionnaires. And after that, we came in the results that it is very worth of introducing in the daily practice. This is one research for that. The oncologic patients, the additional treatment was with acupuncture, 50 patients treated and untreated. And additionally, they received the chemotherapy, acupuncture, and oncothermy. The oncothermy is not a whole body heating system. This is a radiofrequency targeted treatment form. And additionally, we applied the BioBrand, the arabinoxylan. This is a herbal medicine originated from Japan. And the period of the course was 3 months and 1 month follow-up, additional the battlefield acupuncture. And we investigated the quality of life and visual analog scale. The physical well-being was investigated before, and the green color is after the treatment in the following period. The emotional function was investigated before in the yellow color and after the treatment. And the physical function was improved, and also the visual analog scale as well. The general health at the end of the 4th week and the general health of the 24 weeks, it was improved in all the patients as well. We investigated in the dark field microscope before and after the BioBrand and targeted radiofrequency treatment, the blood, and you know there is a significant difference between before and after that. This is the oncothermia protocol. This is a special instrument for the patients, the cancer patients. Does not destroy the healthy cells, only the tumor cells. And we can apply once a week or twice a week, and all together 10 or 12 times in the patients. The oncothermy results all together with the acupuncture and the BioBrand. We have achieved a very nice results in the liver metastasis, the pancreas, and the glioblastoma, lung and ovary, and the stomach and bone. And this is the more targeted diseases for oncothermia specialization as well. And oncothermia, when others fail, we can apply as well. This is a tumor, a very big, relative big cervix carcinoma before the treatment, and after the treatment it would have been operated. This is the cervix carcinoma as well, before the treatment and after the treatment as well. What about the effect of the acupuncture? Because several lectures was talking about the hypothalamus and the effects. We can use the acupuncture for the pain control, the endocrine system, the autonomic nerve system, and for the release of neurochemicals as well. And there is a more complicated, because if we apply the acupuncture as a peripheric biostimulation has an effect for the thalamus and the hypothalamus, and this is the reason we can control the pain, we can control the endocrine system, and the sympathetic and the parasympathetic tone, the coordination, and of course more than 40 neurochemicals release can be improved. This is a research, the comparative study of the immediate stress relevance effect of auricular with soft laser and needles and the battlefield. And this is my colleague. He is sitting here. It is very, very honored. And he was the main author for these articles. And we performed this research a few years ago. Basically, everything is originated from the bowel, according to Hippocrates. Do you remember this? In the abdominal, gut flora can influence the psychoneuroimmunology and the psychoneuroendocrinology as well. And the cortisol level could be increased, and the growth hormone only, and the prolactin as well. And of course, according to this, the cancer is growing. And could be developed in the insulin resistance, which leads to the diabetes type 2 and the arterial disease and cardiovascular disease. In the normal gut flora, the mind could be influenced by the mind as well, and the immunity could be elevated, the insulin level could be lowered, and the prolactin and the cortisol could be lowered as well. That was the reason we applied the NADA and the battlefield acupuncture and the laser acupuncture. The acupuncture has some effect in the cerebrum and could activate the hypothalamus according to the literature. This is the brain response to the verum acupuncture and the stimuli acupuncture and the rest. And you can see the real effective areas for the real acupuncture. The NADA, you know the NADA, this is the 5-point collection. And the NADA was developed for the addictional disease firstly in the Lincoln Hospital in New York. But we published a very nice, with the Széchenyi István as well, in the medical acupuncture, because it was checking and evaluating the immediate stress-reducing effect of the ear acupuncture a few years ago. But the NADA has other indication as well. For example, the depression and the anxiety, anger, body pain, and headache, and concentration of the weakness as well, according to the recent literature as well. And this is the battlefield acupuncture, and we use the laser. And for the laser, this is the special application of the acupuncture point stimulation auricular therapy. We use the 808 nanometer laser class, and the operation was the 10 Hz amplitude modulation, and power supply was 5500. The character of the laser beam polarization, monochromatic coherence, and parallel, you know it. And the important role of the effective biostimulation, not only the wound healing. I have to mention the name of the Mester Endre. He was the father of the soft laser biostimulation. He defended in the Hungarian Academy of Sciences his work 50 years ago. And I was able to know him because I was a young student, medical student at that time. This is the laser acupuncture, and about the research, the background was the immediate stress reduction effect of NADA point, and with the NADA point, and we wanted to compare our results with the battlefield control group as well. There is several machines to measure the acupoint's activity, and according to this, we applied the meridian instrument as well. And the measurement of the acupoints belongs to Dimogé and Fall and Nakatani. And this is the meridian was developed in Hungary by Széchenyi. The material methods was they used the sympathetic kidney, liver, and lung points. And each patient has a blood sample was taken between 2 times and 4 times. And the procedure was the sham laser, the talking group, the film viewer group, and the battlefield group, and the laser group as well. This is the flow chart for that. And there are the results, and the results of the soft laser points, both stress hormone levels, the serum prolactin and the serum cortisol were reduced significantly, which verified the stress reduction effect for the study. The conclusion that the laser acupuncture and also the needle acupuncture can proved by the hormone levels, by prolactin and cortisol, and the skin conductivity response was able to measure by the Meridian instrument, and the limits of the results was it was carried out in the healthy volunteers, and the next steps would be the patients with some complaints as well. And it was very interesting because in the laser group it was significantly the level, and the sham laser was the significant as well, and the NADA was significant as well. Why was the same in the group of the sham laser? Because the psychological hopefulness of the patients. If we trust the medical doctors, this could be improved our answer to the acupuncture or beliefs acupuncture as well. This is the battlefield and the NADA. They're very important to use the correct direction of the needle insertion. This is not a very simple method, and everybody should know it, and everybody should have to learn it. Some references about this. This is the European Journal of Integrative Medicine was published, the effect of complex pain management in the quality of life. The other was the European Journal of Integrative Medicine, the controlled pilot study for cancer patients suffering from chronic fatigue system. And the other references with the Chinese colleagues as well, oncothermia and traditional Chinese medicine, hyperthermy versus oncothermy, and oncothermy combination. I would like to many thanks for my old master, Johann Gladich. He was supported me in beginning of my acupuncture research. That was time, it was not so easy to come out from Hungary, and he supported me all the time, 35, 40 years ago. Many thanks for your attention.
Give a talk on Yamamoto new scalp acupuncture.
Hi, good morning. Thank you for inviting me to come and speak about the Yamamoto scalp acupuncture. My way into Yamamoto scalp acupuncture, the way I discovered, came up by chance. I stumbled onto Yamamoto scalp acupuncture. So when I finished my studies, I went to one of my teachers and I asked to be his assistant in a hospital that he works in, a department of rehabilitation, where they use acupuncture, complementary medicine. And he said, yes, come. You're more than welcome to come and follow me and be my assistant. It's mainly light in moxa, watching the moxa and all that, but you can watch me treat and you can get all these methods how to practice it. And now I knew this, my teacher, he also studied Yamamoto in Israel, and he used it not too often. And when I asked him, I remember when I was back in school, and I asked him about this method, he said, stick to what you have before you bounce and go and learn this method. So I said, okay, fine. And I was there working with him in the hospital for about 6 months. And then one day, a different practitioner walked in. He was actually called to come treat a patient after a stroke with paralysis of his right side. And now the patient could move his hand very slightly, about maybe a centimeter off the table. And he was called to come and treat this patient to help him in his rehabilitation. This guy, practitioner's name was Gil Kotler. And actually he was called in because that was his main topic. He was mainly working with Yamamoto and getting very, very good results. And then I came and I watched him work. And they wheeled in this patient. And after about 2 to 3 needles of using this Yamamoto, the patient, from about taking his hand up to 2 centimeters of the table, could take it up to nearly mouth height. And I was like, wow! Wow. And I've only heard about these things. I've never seen it happen. I haven't seen such a strong effect in acupuncture at all. And then Gil and me come from the same region in Israel, and asked him if he can teach me the method. And he said, oh, just tag along and watch me practice. So I actually came up with a new idea. I said, why don't you teach me? I'll get you students organized, and maybe you can teach them the method. And he said, okay, let's do it. And that was my first step. I studied from him about the Yamamoto scalp acupuncture. And things that Gil always said to me, fly to Japan and go study and see how Yamamoto works with the method. You have to. And then I decided that's what I'm going to do. And I flew there. And flew there a couple of times. And in one of the times that I was there, I had the great honor of being only 4 students in a seminar with Yamamoto. And this was because of the earthquake that they had, I think, 2012. And everyone canceled. So only about me and another 3 students came, which one of them was Japanese, so he was only there for 2 days. So we had actually kind of very private lessons with Yamamoto, which was amazing because we could feel the points, and he had time to explain more about the method. So it was a great honor for me. And that's how I stumbled into Yamamoto scalp acupuncture. And slowly, I started using it more and more in the clinic, more and more, and slowly, because the results come so fast and the method is so simple. Once you know it, it's so simple and so easy to use. Just like Gabriella explained, you only 3, maximum 6 needles, and you get an amazing result. And this was what's happening. And because we were getting such good results, at the same time, I was approached by the head of the department of the rehabilitation hospital in Bnei Zion Hospital, and she started referring patients from the hospital, because my clinic sat right by the hospital. She started referring patients from the rehabilitation, come out of the hospital, they were admitted for stroke patients, to treat. And we were getting good results. And then she said to me one day, you know what, let's start doing research on this method. And we started doing research on the method on post-CVA patients from 3 years to about 6 years after the stroke, with hemiplegia and shoulder pain and spasticity. That's, if you know, that's one of the hardest things to treat in stroke patients, is a spasticity and a shoulder pain due to stroke. And my idea was, okay, we can do this research, but I want to combine it with physiotherapy. And I want to see the difference between a patient doing physiotherapy while he has the needles in the scalp to a patient who's not doing who's only doing physiotherapy. And we came up with this idea, we'll do a cross research. It stayed at a pilot level because patients had to come 3 times a week. Some of them could not miss a week for 18 weeks. So it kind of stayed at a pilot level. But that actually, because we were getting good results with the method, we decided to integrate it into the rehabilitation department. And today, after about nearly 10 years, all the patients in the rehabilitation department in the hospital receive, while they're doing physiotherapy, occupational therapy, they receive Yamamoto new scalp acupuncture treatments. Because one of the advantages of this method or in general, scalp acupuncture, is that all the needles are needled in the scalp. And once you have the needle in the scalp, you can move around, they can move around freely without any, pain. If you insert the needle into the body, they can't move their hand, they can't move the leg, they can't walk. It's kind of a disadvantage. But with scalp acupuncture, you can get all these effects on the body, and at the same time, they can manually move and do their daily practice. And we were getting great results. And unfortunately, in the end, the head of the department said, I want to really know how this method works. How does it affect the brain so much? And we were going to do we're starting to work on a research with, we had actually the head of Parkinson's in the rehabilitation neurology. We had one of the leaders in Parkinson treatments in Israel. And he said, I want to see as well how it works on these Parkinson patients, and we are going to do, but I want to do it with a brain scan, doing an fMRI once they have the needles in. And we started developing, okay, you got to do fMRI, we can't use steel needles. We have to see how we can use maybe protein needles or plastic needles, something that can be used instead. And we started developing it. But unfortunately, as you know, in Israel, I don't know how it is in Europe, funds are very, very low, especially for acupuncture or complementary medicine. You don't have any drug companies that want to support this kind of research. So it was basically, they were going to invest in this research on other funds. But unfortunately, this doctor passed away, and the research was kind of thrown away. But hopefully, maybe in the future, we can get it going again. But that's about Yamamoto scalp acupuncture. One of the things that I found that was great about Yamamoto scalp acupuncture is that it is a very easy method to use compared to other methods of scalp acupuncture. If you're familiar with the Zhu method, Shunfa method, those methods, I studied them in school, and I was like, oh, I'm not really going to use it. How do I know if I'm needling the correct areas, the correct zones, and getting a response? And the only way I can see the response is according to the patient's response. So I kind of left it. But I want to speak, before I speak a bit more about Yamamoto scalp acupuncture, I want to speak about, just in general, about Chinese acupuncture or Chinese acupuncture. So as we know, there's been basis even in the Yellow Emperor, the Huangdi Neijing, that goes back to the 100 BCE, where there's explanation in those terms, in those days, and how they believed the combination between the body and the brain, how there's a connection between the two, but they explained them in those terms. And if you really want to go into it, you can read chapter, I think it's chapter 84, where there's a discussion there between Huangdi and Chipo. And Huangdi actually asked him what happens when a patient kind of faints, or a patient goes into a coma, or he's blurry, and how do we wake him up? And Chipo basically explains to him, there's a very good way the way to wake him up from a coma, very, very simple, needle the patient's big toes. To any acupuncture, doesn't specifically explain written down to the points, but he says, needle the points on the foot, and then take a bamboo straw and blow softly into the patient's ear. Okay, so let's start. And if we go into this, what we're basically doing, if we go to the brain now, look at the homunculus. What is the largest area in the homunculus? Is the foot. Okay, the foot, as motor or sensory, is the largest area that we have on the homunculus. So basically, you want to give a strong stimulation through the peripheral nerve system of sensory of the foot. And then we go to blow in air with a bamboo straw into the ear. What are we doing actually by doing that? We are blowing air into the ear, and we affecting the proprioception of the patient. So we actually giving a strong proprioception of the patient to wake up, and at the same time we needle in the foot, which will kind of get him aware of his state and maybe bounce him up out of the scalp. So that's in chapter 84, whoever wishes to read it, and that's kind of my explanation. I heard this explanation basically through a practitioner by the name of Dr. Amy Mall. I listened to her, and she spoke about it, and then I went to start reading about it, and I started seeing the connections between the two. So basically that, and it's an excellent text. But as you can see, they were always looking for this connection. And we'll go more into scalp acupuncture. Today, the modern system of scalp acupuncture, because even if we go back into the, sorry that I'm bouncing back, to 100 BCDE, they were speaking about using acupuncture points to treat neurological disorders. Okay? And then in the 1950s, they started connecting or looking for the connection between the nerve system, or kind of developing the nerve system Western neurology with acupuncture. And from the 1950s to around the 1970s, mainly Chinese physicians were playing with this idea how to connect between Western neurology to traditional Chinese medicine. Because if we think it's a bit maybe very shallow in thought, that there is some similarity between the channels and between the nerve system. Because everything due to all these neuroscience, all these medical Chinese physicians that developed, or you were using scalp acupuncture, they were speaking about that if you want to change the outcome of the patient, you just got to rewire the brain. So it's basically rewiring channels, or like doing a plumbing and opening the channels. If you open up the channels, the patient's functions are going to work a lot better. So basically they were saying the same thing. And if you think about 1950s, they were speaking about neuroplasticity, when then neuroplasticity was like, oh, it doesn't really exist. Your brain develops to a certain age, and once it's developed, that's it. In childhood, afterwards, if you lose a function, it's gone. But today, this is the new thing in neuroscience, is the neuroplasticity, and understanding that the brain is constantly changing and constantly making new connections. And that's got to do with new input, old output. So even with that, if you think about in the last 60 years, I think scalp acupuncture, if you take acupuncture has been existed for let's say 2,500 years, 2,500 years. But if you take modern scalp acupuncture, and it's been developing, or maybe it hasn't been developing more than the understanding of how to use it, and the understanding of how to use it, and more the understanding how to use it in our Western world, into our Western terms. And if we take scalp acupuncture, in the last 60 years, scalp acupuncture is developed amazingly. And Yamamoto scalp acupuncture is also developed amazingly in those. Yamamoto's about 45, 48 years is developed amazing. That's the most developed system in the last few centuries. Decades or centuries? Decades. Okay, so before that, I want to speak this is scalp acupuncture. This is maybe 6 different physicians, Chinese physicians, that have got different models of different areas and different zones in the scalp. But all of them have the same basis and the same understanding that you actually want to needle on the scalp the same areas that correspond with the neuroanatomy of the brain. Okay? If you want to affect the motor cortex or the sensory cortex, you're basically going to needle on the scalp. You're going to thread the needle through the scalp and do some type of manipulation on the areas that correspond with the areas of the brain. And just to say, all these 6 practitioners, just to make it a bit more understandable, is this. It's basically the 6 different practitioners that have been using this method. So I put Jiao Shunfa right up there, and I enlarged his picture because he is known as the founder of the scalp acupuncture. And he first presented his work in 1970, and he actually was the first one to really speak about the connection between traditional Chinese medicine, traditional Oriental medicine ideas with Western neurology. And his maps were very, very simple, and it was based on Western understanding of neurology. And as Western understanding of neurology developed, so did the scalp acupuncture develop. So if you think what we had 50 years ago or 60 years ago to what we have today, that means those systems were developed. So that's Dr. Jiao Shunfa. We have Professor Zhu, who actually also came up what we see here. Other areas, several areas that have some effect on the brain. Again, his idea, these areas correspond with the areas of the brain. Then we have Dr. Yu Feng Peng, who's speaking about one homunculus, very similar, that radiates through the whole sagittal line from the occipital area to the front head of the map of the scalp. Not necessarily this corresponds. Then we have Professor Zhu Mingzhu and Professor Yu Zi Shun, where actually they were speaking of the connection between the channels and using acupuncture points and explaining acupuncture points, how they have an effect on the brain. and showing how they correspond with the anatomy of the brain. Like let's say, for example, if we take DO20, one of the indications could be paralysis or numbness of the foot. And if we look at the location where DO20 is located, DO20 is located in the area of the foot of the homunculus. So that's the connection. Another area, if we take the areas of balance, like UB9, balance. UB9 is of how it affects the vision. It's located on occipital bone, which is connected with the occipital, the visionary area and the balance of the cerebellum. Okay, and then we have Professor Tung, who actually was using two homunculus, one in the back, one in the front. So we have this whole mixture, which brings us back to this whole mixture and how we have so many points. And I haven't even put Yamamoto's scalp acupuncture here. But the thing is, in Chinese scalp acupuncture, all these zones have to be threaded through and manipulated. And the only way you'll get a good effect if you manipulate it. You'll get a better effect. And it's usually electrostimulation to manipulate the needles, except Zhu, who manipulates it manually. So with that, oh, sorry. We'll go to Dr. Toshikatsu Yamamoto. Today, I think Dr. Toshikatsu Yamamoto is close to 90 years old. When I met him, he was so strong, such a vital human being. Even today, you can see his great smile spreading around the room. He just walks in the room, he has his presence. One of his sentences I like that he says, if you go out of the library, any pain and any paralysis can disappear. Basically, he's saying that if you go out of what is categorized in library or in books or in textbooks, if you stay in those borders, you will be very limited with these methods. And Yamamoto is saying that there's so much still more to understand about the body, and especially about patients, that you can treat anything. You just got to be continue perseverant and go the mile with the patient, and let the patient go the mile, and you can help him in all the disorders, and you got to be a lot open-minded. He's very open-minded. He's a Western doctor. He studied anesthesiology in Nippon school. He finished his studies in 1956. After his studies, he done a 2-year internship in the United States in anesthesiology. Then he flew back to, I'm doing a quick story about him. He flew to Germany, and there he done obstetrics and gynecology, and then he went back home. And he always says that he stumbled onto acupuncture or scalp acupuncture by chance. And the reason is he was actually treating pain, managing pain. He was doing injecting a neural block into patients, dilating 1 cc to 1 cc with saline, and dilating it into a patient. Until his story goes by chance that one day a patient walked in and suffering from lower back pain, and he gave her the injection. And pain actually, she had a very sharp, intensive pain, and he was very puzzled how come she reacted like this. And he actually discovered that in the end he never injected any drug. He only injected the saline. And the next day when the patient came back, he was sure, okay, that I'm going to be sued for medical malpractice. But she was speaking that the pain was gone. Up until that day, he always heard about acupuncture, he read about it, but he never really was interested. And then he actually started using it and started studying acupuncture. And he started using it in his clinic. And slowly, more and more people, he started using in his clinic, in operating rooms. He performed over 2,000 surgeries with no general anesthesia and only using acupuncture as anesthesia. Amputations, appendicitis, just go at it. And he said that all these patients, the recuperation from the operations a lot faster, and they felt a lot better. And then again, he says by chance, and he was always looking for these alternative ways how to manage pain without using drugs, which was his key, what he was always striving for. And then he went, when the scalp acupuncture came out, he went and he studied it, and he learned it, and he started trying to apply it in his clinic. And then again, he said he came about by using YNSA by chance, or discovering it by chance, due to a very sensitive patient who had hemiplegia and pain, shoulder pain. And when he was looking for the areas of the shoulder in the Chinese zones, he pressed an area on the temporal zone. And when he pressed the point on the temporal zone, the patient felt an immediate relief in his shoulder. This is what is called the C point. And then, as Yamamoto is always thinking how to put one and one together and how everything connects, he started saying, okay, if I have a point, I have points in the Chinese scalp acupuncture very, very useful for headaches and migraines. Then and I have an area in the shoulder. Okay, so if I have the area in the shoulder, here the area from the Chinese scalp acupuncture, let's start drawing out this whole microsystem. And he started going point by point, and for the first 12 years, he was only using 5 points and getting amazing results in managing pain and treating patients after a stroke and getting them to a very good state of rehabilitation. Only using 5 points, which are the basic points. And from those basic points today, I think we have over 60 points of scalp acupuncture of his method, which are divided into kind of 6 groups. So we have the basic points, which are the first points which Yamamoto discovered. Each point different from Chinese scalp acupuncture. Here you only have to needle a point. Yamamoto also speaks about you don't need to stimulate the needles. Even just having the points located in the scalp and the patient's movement is doing enough stimulation on the needles, so that's the stimulation you need. Then you have, that's the first group, you have a second group of the cerebrum and the brain points, which is combined of the sensory organs. You have each point for the organs. Then we have the epsilon points. The epsilon points are originated with the channels. He says the needle in the epsilon points affects the full length of the channel. So you've started to have a connection here between Chinese acupuncture and Western neurology. He's really making the gate between the two in a very, very peculiar way. And in my practice, actually, because of this, because I do a lot of palpation on the channels, I started seeing what happens if I needle epsilon point or / a cranial point, how does it affect the channel? And I started seeing that the sensitivity of the channel goes down. So there is a connection. Don't know what, not sure how, but there is a connection between the two. And then we have the cranial nerves. Today in the afternoon, I'll speak about a lot about the 4-6 cranial nerves, speaking about how the heart, which is associated with the heart, the bladder, kidney, how it also affects the brain and also affects the channels from my experience. And then Yamamoto, because Japanese acupuncture does a lot of palpation, a lot of diagnosis. In Chinese, we use a pulse and other types of diagnosis. Tongue, he uses palpation as a diagnosis. So we have also 3 areas of diagnosis. We have, which is the abdomen diagnosis, which is the most, the first diagnosis he used. Then he had the neck diagnosis for the organs, which is, unbelievable that the neck is specifically from YNSA. This is Yamamoto. The Chinese, the abdomen is a variation between Oriental medicine, Japanese medicine, and Yamamoto. And the neck is specific Yamamoto scalp acupuncture. And I think in the last 10 years, he's developed elbow diagnosis, mainly used for brain points, basic points. But now, even recently, he has even developing a diagnosis in the palm of the hand already to diagnose the basic points. If you ask Yamamoto, why do you keep developing the method? And I remember we asked him, how do you keep developing the method? And he said in one word, YNSA is very boring. So what do you mean? He said, it's boring. What do you think? You're going to needle the same points all day? I've got to strive to look for more information. It's very boring, but very simple. And that, I think, is the genius of the YNSA method. So today we'll speak more, in the afternoon we'll speak more into depth about how you can use it. It's mainly used scalp acupuncture in integration in Western medicine in rehabilitation. Well, I took the model of speaking about walking, but we'll speak about that. And that's it. And if you have any questions, thank you very much.